I'm Eileen Doherty, Director of the Colorado Gerontological Society. The Society was organized in 1980 as a not-for-profit organization. The Society is a major advocate for older adults in the field of Medicare. Today, I have with me Chandra Price. She has a master's degree in education. She is a former high school teacher, and based on a career change, she has now joined us in the world of being a Medicare trainer and educator, as well as a licensed broker. Welcome, Chandra.
Thank you for having me.
You bet. So what we'd like to talk about a little bit this morning is vaccines. And so can you tell me what vaccines are covered by Medicare?
The vaccines that Medicare covers for under Part B, as in boy, are the flu shot, the pneumonia shot, and the hepatitis B shot. Medicare Part D, as in dog, also covers some flu shots, such as the Shingles shot and the Tdap shot.
So what are some of the complications that older adults experience from the flu, hepatitis B, pneumonia, and shingles?
Most people actually experience very mild symptoms. You might see commercials on TV for medications where they have the voiceover, where they describe all of the scary side effects that you might have. Most people don't experience side effects, but if you did, you might experience some muscle pain, some mild flu-like symptoms, for example, with the flu shot. Nausea, dizziness, headache. Occasionally, you can end up with achiness, stiffness. Occasionally, the shingles rash might appear, and you might have some allergic reactions. But your doctor or your healthcare provider will review potential complications with you. And again, most people don't have complications when they get their vaccines.
Well, that's good to hear. So all of this fear that sometimes people have related to getting vaccines is probably happens once in a while, but most of us don't really experience that.
Correct.
So when is the best time to get vaccines?
Well, the one that you will get annually is the flu shot. And the flu shot is recommended in October, sometimes even in September. Because remember, it takes a couple of weeks after you get the shot for your body to develop the antibodies, which is why you're getting the shot. So you want to make sure that your body has had enough time to protect yourself before flu season really starts, which is typically in November and through the winter. So the flu shot, by October, you should be getting it right about now, the beginning of October. The other shots, you'll talk to your healthcare professional because you might have already had some vaccines and it's in your file and you just have forgotten. Or if you are at high risk for certain vaccines, your provider is going to recommend that you get them. And there's not a set time during the year that you need to get the other vaccines.
Are there any costs associated with getting vaccines?
Part B, again, B as in boy, vaccines are covered by Original Medicare, which is that paper Medicare card that you have from the federal government. Some people have used that paper Medicare card and have a Medicare supplement. Okay, so if you're using two cards, your vaccines are covered with your paper Medicare card under Part B. You will pay nothing. If you have a Medicare Advantage plan, that's typically when you have that plastic card in your wallet that replaces your paper Medicare card when you go to see your healthcare providers. Your Medicare Advantage plan is also going to cover your Part B vaccines at no cost to you. When you might incur a cost for a vaccine is if it's considered a Part D, D as in dog, vaccine. And so you want to make sure that you do have Part D coverage. It's not part of Original Medicare. So you have to enroll yourself into Part D. And if you have a Part D plan, you would pay the costs associated with your Part D plan. Some people will pay, sometimes, like for example, a shingle shot would be considered a Tier 3 medication on many Part D formularies. Formulary is just a fancy word for drug list. So if you have a Tier 3 medication, you would pay the cost that's associated with the Tier 3 with your drug plan.
Just to remind all of our listeners, Part D is the part of Medicare that covers prescription drugs. Part B is the part that covers physician services, labs, x-rays, emergency rooms, ambulances, all of those kinds of things. So how many shots do you need with the shingles vaccine?
With the shingles vaccine, the recommended vaccine is called Shingrix. And that vaccine it's a series of 2 shots. You have 1 shot, and then about 6 months later, you would get the second one. And you would pay for each shot according to the costs associated with your Part D prescription drug plan. Occasionally, people will get a 1-shot Part D vaccine for shingles, which is called Zostavax. But the Shingrix is really the preferred vaccine for shingles.
And just to clarify, all the other shots, the flu, hepatitis, and pneumococcal, those are a single shot. And again, the frequency depends on what the shot is and what the vaccine is and what it covers. So where do you go to get these vaccines?
Well, you might get your vaccines with your provider when you go in to see your doctor. You might get your vaccines at the pharmacy, and you'll talk to your doctor when your doctor is recommending your shots. You'll talk to your provider about where you should receive them. Your Part B, as in boy, the shots that are covered under your original Medicare and under the medical services, those are typically provided and administered by your healthcare professional while you're there in the office. The Part D drugs that are part of your drug plan, you'll typically get those at the pharmacy. The Part D drugs have 2 costs associated with them, the cost of the drug and also the administration of the drug. So if you have a Part D drug and you're purchasing it from the pharmacy, but your doctor is actually administering it, you might end up with a small extra charge, an office visit charge from your doctor. So talk to your doctor about the best place to go.
You can also sometimes get some of these vaccines at various kinds of community clinics. Sometimes they're available there, and you will see promotional information related to that. So do you have any other final comments for our listeners today?
No, I think you've done a great job of covering everything, Eileen. I do want to encourage you to go and see your doctor. Under Original Medicare or your Medicare Advantage plan, you are covered every year for an annual wellness visit, and that's at no cost to you. So I would encourage you to talk to your doctor about what vaccines you might be due for. For example, the hepatitis B shot, we didn't really talk about that much. You're only going to get that one if you're at medium to high risk for Hep B. And that would be a conversation that you would have with your provider. So do make sure that when you go to your doctor's office, you take some notes so that you go in and don't forget all of the things you'd like to cover, and cover the vaccines that will keep you safe and healthy.
Okay, well, thank you, Chandra, for being our guest today. And for our listeners, you can find us on YouTube or wherever you get your favorite podcast. The Colorado Gerontological Society is glad to bring you this series of information on Medicare, and we look forward to having you join us in the future.